Hi guys, my name is Jessie Mel and I'm here today at AstraZeneca to interview three amazing people, Richard, Victoria and Heather, about some of the really cool projects they're undertaking in this amazing company.
Hello, so my name is Victoria and I'm a scientist at AstraZeneca in bioassay development.
Okay, so tell us a little bit about what you do, first of all, on a day-to-day basis.
So on a day-to-day basis, what I do in my department is develop potency-based assays, both binding and cell-based assays, to test any activity in the drugs that we have in the clinical trials or in the production in general.
Okay, and so obviously we have this really cool device and it reminds me of something out of like a Marvel movie or something. So would you like to explain what this is and how cool it is?
Yeah, sure. So this is a HoloLens. It's a Microsoft product, and what it does is that it has, it's an augmented reality and it has hologram overlays. So the really nice thing about this is that you can see everything around you, but you can also see the holograms. So if you are in the lab and you're a lab-based scientist, then it won't interfere with anything you do in the lab.
Okay, that's really cool. How did the idea come about and how is it so influential in the way you do things now?
So the idea itself came as a collaboration between research and IT. So the problems that we face in research, and especially if you work with 96 well plates or 384 well plates, like we do in bioassay development, is that occasionally you end up making mistakes, and as you can imagine, it's really difficult to track where you are in a plate. So if you have a major mistake, that means you have to repeat the experiment. If it's a minor mistake, it's a deviation. So it could lead to more waste or more time spent on the research. So with this collaboration, we're working on developing an app which will allow us to track where we are in a well. So even if you take a break and then you go away, or someone comes to you and asks you, would you like to join for lunch? And then all of a sudden you get distracted, you will be able to still see because it projects the overlay plate and it will show you where you are in a well.
How is it like working with different departments and communicating with them and talking with them?
I think the collaboration is what definitely leads to the great research. So as you can imagine, we might not have all the equipment, or ideas that we have might be limited. So working with other departments just means that we can do the research faster as well. And with the HoloLens itself, because you can connect, because it's Microsoft Office integrated, you can connect with anyone in the world. So with our colleagues in Gaithersburg in US, you don't need to have them travel, or if you're doing something like training, you will be able to train them much quicker as well. So it saves us traveling, it saves us time, it's more sustainable as well.
Mm. Could you tell us a little bit about your journey to becoming a scientist in AstraZeneca? What did you do, and any advice you would have for anybody that would want to work in your position or in this amazing company?
So I have graduated my bachelor's with biomedical science, and then I've done master's in pharmacology and drug discovery. I think what really helped me to get this job, and first of all, I've actually done a graduate scheme in AstraZeneca called Rotational Associates Program. So it's those internships here and there, and any work opportunity that you could get as a student is very helpful when it comes to getting either a graduate scheme or a job. And yeah, just being proactive and taking every opportunity that there is, and making it a big thing as well, that could help.
Yeah, thank you so much for speaking with us today. I really enjoyed this conversation.
Thank you, same here.